class. My name is Professor X, and today we will be discussing Mrs. M. Mrs. M is an 85-year-old Chinese female admitted to the hospital following an episode of chest pain. She was brought to the hospital by her husband, Mr. M. She describes the current episode beginning early this morning, with similar episodes over the last month. The pain is to the lower chest, non-radiating, feels like an elephant sitting on her chest, and she rates it at 7 out of 10 on a pain scale. The pain seems to improve with rest, nothing makes it worse, and has been intermittent since it began. With this, she is also experiencing fatigue and nausea. In previous episodes, Mrs. M would take Mylanta, however she noticed no improvement after taking Mylanta today. Additionally, she has been taking Chinese herbs to try to remedy the pain. Her past medical history includes hyperlipidemia and hypothyroidism, for which she takes Lipitor and levothyroxine as prescribed. On a review of symptoms, Mrs. M does not endorse any associated complaints of dizziness, shortness of breath, recent cough, or vomiting. Mrs. M lives with her husband of 50 years.
On examination, Mrs. M's vital signs and physical exam findings are as follows. She's alert and oriented ×3. Pulse 100, corresponding with mildly tachycardic and slightly irregular pulse. Blood pressure is 185/95. Breathing 12 times per minute. Lungs are clear, heart sounds are normal, and she is afebrile. Diagnostic studies came back with normal chest X-ray, elevated cholesterol at 250 milligrams per deciliter, and thyroid levels within normal limits.
Thank you, Nurse Sally. Now, let us discuss what to do next. Here's our concept care map, which provides a roadmap for patient care. We will use this information to form a nursing diagnosis, from which we will come up with our short-term and long-term goals, along with correlated treatment interventions and teaching interventions. Now let's discuss one goal and one intervention we will be incorporating into our care plan for Mrs. M. One of our long-term goals for Mrs. M is to have effective cardiopulmonary tissue perfusion, as evidenced by no chest pain and normal blood pressure values of at least 120/80 during rest by discharge. And the associated intervention is to perform chest pain assessment every 2 hours using a functional pain rating scale. The rationale behind this intervention is that ongoing chest pain evaluation is important because decreased chest pain is a cardiac symptom indicating improved cardiopulmonary tissue perfusion. Now that we have incorporated our short and long-term goals as well as interventions for each goal, let us evaluate how we performed in meeting our goal. Would you care to summarize the results of our long-term goal for us, Nurse Sally?
I'd love to, thank you, Professor. As mentioned, the long-term goal that was created for Mrs. M was to have effective cardiopulmonary tissue perfusion, as evidenced by no chest pain, and normal blood pressure values of at least 120/80, during rest by discharge. After a 2-night stay in the hospital, Mrs. M has made a full recovery. She no longer feels chest pain, and her blood pressure is sustained below 120/80 while resting.
Excellent work, Nurse Sally. Now, let's check in with Nurse Sally, who will be educating Mrs. M for discharge.
Hello, Mrs. M. Before we discharge you, I wanted to make sure you had a full understanding of everything that happened and how to take care of yourself. To put it simply, you had a lack of oxygen to the heart. If left untreated, this can lead to serious complications such as heart attack, irregular heart rhythm, and heart failure. Because you listened to your body and came in, we were able to increase the blood flow to your heart and prevent further injury. Does that all make sense?
Yes.
Moving forward, we would like you to monitor your blood pressure regularly. Do you know what normal limits are? And how to use your blood pressure machine?
Yes, I do, and 120/80 are the normal limits, right?
Good job! If you have any chest pain, shortness of breath, and sudden weakness, please contact your doctor or call 911 immediately. The doctor is going to send you home with a new prescription for metoprolol, which lowers your blood pressure, and aspirin, which is an antiplatelet medication. It is important that you take these as prescribed and call us or your pharmacist if you have any questions. For now, the doctor would like you to stop taking Mylanta along with the Chinese herbs. We want to see how your body responds to these new medications first and avoid any adverse reactions. In your brochure there is a guideline of what a heart-healthy diet is. We want you to follow that so we can improve blood pressure and improve cardiopulmonary tissue perfusion. Is that diet a realistic change for you?
Sure is.
And finally, engaging in low-intensity aerobic exercises such as walking, dancing, or housework for at least 30 minutes a day can help improve cardiovascular function. Keep up with those breathing exercises and aromatherapy at home to help lower your stress and control your blood pressure, thus improving cardiopulmonary tissue perfusion. What questions do you have for me, Mrs. M?
None, you explained everything very well. Thank you for everything.
All this is laid out in your care instructions, and if you have any questions, don't hesitate to reach out.
Great, thank you for all your hard work, Nurse Sally. Let's touch base with Nurse Imogene King, who will apply her theory of goal attainment to assist with Mrs. M's successful discharge.
Hello, my name is Imogene King. I am here to discuss how my theory of goal attainment is applicable to the case study of Mrs. M. My theory describes the process by which a goal is set by a patient and nurse and then met. Now let's apply this to the case study of Mrs. M. In order to develop and attain this goal, the process of perception, judgment, action, reaction, interaction, and transaction takes place. Mrs. M perceives that you check on her often and speak knowledgeably about her medical condition. Mrs. M makes the judgment that you care about her and have valuable information. Mrs. M takes the action of actively talking to you to create a goal together. You perceive that Mrs. M misses home and that she asks questions like, "Why did the Mylanta not help my pain anymore?" You judge that Mrs. M wants to return to home and her usual activities and that she has a knowledge deficit about her ineffective cardiopulmonary tissue perfusion. You take the action of mutually creating a goal with her. That goal is knowledge transfer about how to safely return home. You react to Mrs. M by teaching her about her nursing diagnosis, signs, and symptoms that require medical care, her medication regimen, and appropriate diet and activity. Mrs. M reacts to you by actively engaging in the teaching, such as repeating back teaching, pointing to information on her brochure, and listing heart-healthy meals she can cook at home. This active teaching process is an interaction. Finally, the goal has been attained when a transaction takes place. Relevant knowledge has been transferred from you to Mrs. M about safely returning to her normal activities.
Oh my God, Steven. Look at those vitals. Her blood pressure is so high, man. What are we gonna do? Well, it looks like you have chest pain and you can't deny it. My other symptoms, yeah, you know they multiply. When Miss M walks in with that pain on her chest, handheld her breast, you better believe she gonna get assessed. I'ma pull out that cuff, cause I notice these arteries, man, those things are tough. Deep in my eyes she's staring, I'm hooked and I cannot care an old patient. I'm about to take your heart's picture. Your doctor tried to warn you, but your lifestyle makes me worried. Oh man, where's the gurney? Say you want to get to this bed, well you can use me, cause I know all about nursing. I see you grimacing, to hell with frowning. We gonna get you back to smiling. Yeah. She sweat, wet, like my bed. When she needs to go to the vet. Man, I'm tired of all these magazines saying salty foods are the thing. I take the average nurse and ask him one thing.
What do you ask?
I tell him this.
What do you tell him?
You better lay off those salty snacks. So nurses, yeah, your patient got that pain. Hell yeah. tell him to rest it, distress it. Keep that healthy heart, baby, get well. You get an adequate tissue perfusion.
Oh, Mrs. M, I want to help you and admit you. She's stressed and her body needs rest.
With an adequate tissue perfusion, you get chest pain.